Sustainable Development Goal number 3 aims to ensure good health and promote well-being for all at all ages. The protection of this has never been so important because of the pandemic. According to the United Nations Development Program, at least 400 million people have no basic health care and 40% lack social protection. More than 1.6 billion people live in fragile settings where a protracted crisis combined with weak national capacity to deliver basic health services present a significant challenge to global health. By the end of 2017, 21.7 million people living with HIV were receiving antiretroviral therapy, yet more than 15 million people are still waiting for treatment. 7 million people die every year from exposure to fine particles in polluted air. More than 1 of every 3 women have experienced either physical or sexual violence at some point in their life, resulting in both short and long-term consequences for their physical, mental, sexual, and reproductive health. Every 2 seconds, someone aged 30 to 70 years dies prematurely from non-communicable diseases such as cardiovascular disease, chronic respiratory disease, diabetes, or cancer. Good health and well-being does not only concern clinical and medical services, but as well as the basic health services, waste management, hygiene, and water and sanitation.
Access to good health and well-being should be a human right. Poor health limits our economic opportunities and threatens our ability to function to the fullest.
The Sustainable Development Goal 3 offers a new chance to ensure that everyone can access the highest standards of health and healthcare. This goal is an important target in order to address global health priorities and strengthen a bold commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030.
Other targets of SDG 3 include the following: reducing global maternal mortality ratio, ending the preventable deaths of children and infants, strengthening the prevention and treatment of alcohol and drug abuse, and as well as ensuring universal access to safe and effective medications and vaccines, as well as sexual and reproductive healthcare services.
To support this vision of the United Nations, countries all over the world need to take the necessary actions to improve their healthcare system and make it available across all socioeconomic stages. In the Philippines, President Duterte signed the Universal Healthcare Bill into law last 2019, which helps ensure inclusive access to affordable and quality health services and the extended efforts to protect the Filipino people from health risks and hazards.
Through the years, emerging global health matters have proved that we humans need to capitalize in our health system and that we need to care about each other's welfare. If anything, the COVID-19 pandemic has taught us that poor health facilities and the lack of support to our health system could cause adverse effects to both the people and the economy.
Realizing and actualizing the SDG 3 is one way of ensuring a better future for all. But it needs our collaborative commitment to advocate for support in our health programs, call for reformative laws in addressing possible mass diseases, and self-practicing a healthier lifestyle.
We may have come a long way, but still, we have a longer way to go. Real progress means achieving universal health coverage for all. So, what we can do to help? You can start by promoting and protecting your own health and the health of those around you. By making well-informed choices, practicing the safe sex, and vaccinating your children, you can raise awareness in your own community about the importance of good health, healthy lifestyle, as well as people's right to the quality healthcare services. Take actions through schools, clubs, teams, and organizations to promote a better health for all, especially for those vulnerable. With everyone's help, we can achieve an accessible physical and mental health care assistance and promote well-being regardless of your age, gender, social status, or race.
This is Glycer Chinji Espereda.
This is Josilu M. Galupo.
And this is Nashan Al Ebno, and we are student advocates for SDG 3.